Good afternoon to all. Good afternoon, ma'am. Yeah. So today we are going to see a DD-based approach, which is very essential in our hospital setup, where we will be doing in our patient, like before touching the patient, after touching the patient, before any aseptic procedures, or before you get exposed to any other surgical procedures, or might be before and after contamination of the blood and body fluids. So this procedure is essentially universally practiced in all around the world to minimize the infection. Can you guess what is the topic? Yes, very good. So today we can clap ourselves that we are. So we are going to see about hand hygiene. So in the introduction, it has stated that clean hands are the single most important factor which prevents the spread of pathogens and antibiotic resistance in healthcare system. So here two things you can see, two important points. One is that it's preventing the pathogen. Pathogen in the sense the microorganism growth is controlled. And the second important point is that it is also preventing antibiotic resistance. Because of this hand wash, we are not going to spread the infection. If infection is spread, all the patients will be getting antibiotics. So we will be purging large amount of antibiotics to the patient. Thereby, indirectly, we are also preventing the antibiotic resistance. And then, yes. And here they have said that it is also reducing the hospital-acquired infections. And there is an estimated study where they have said that nearly 2 million patients in the US get infection out of this hospital-acquired infection. He is the father of hand wash. So the major founder of hand wash who discovered that this without the sterile hands, doing the hand washing technique, there is no more chance of spread of infection. When he found that during the postnatal period, more mothers were going for death. More and more mortality was seen among the postnatal mother, especially in the obstetrical clinics and the general hospital. And then he tried to do with some of the local agents like antiseptic agents, and then with plain soap and water he did a small study, and with that study he found that the nurses who had good antiseptic hand wash were having very minimal post-puerperal sepsis, post-puerperal fever and so on. But with only simple soap and water hand wash was not preventing the infection. Thereby this Ignaz Semmelweis was the father of hand wash who first discovered the steps and as well as the need for hand hygiene. So we all know we will do the major moments of hand wash is that the first point in that you can see before touching a patient. So before you touch a patient, there can be microorganisms in our hands. So we are actually preventing the spread of the microorganisms from our skin to the patient's skin. In the further slides I will be telling like what are the common areas, where are the common areas, what are the common normal flora. Normal flora means normal microorganisms present in all our body. So thereby by doing a hand wash we are going to remove that particular streptococcus. Then the second point is that before clean or aseptic procedure. Clean procedure might be you do a back care or doing a positioning of the patient, nebulization. Like that you give mouth care, oral care, eye care. In case of aseptic procedure might be invasive procedures such as central line insertion, IV insertion, catheter insertion or NG tube insertion. Anything which is going into the skin or anything which is going into the cavities, that we call it as the aseptic procedure. So aseptic procedure as well as clean procedures we need to do the hand wash. And the third point is that you can see it is very close to the urobag. So here they are saying that after body disc in the sense not visibly seen. Might be you are touching the urinary catheter tubes, you are touching the central line catheter tubes, you are touching opening the IV cannula tubes. So thereby indirectly there is high risk of direct exposure of the blood body fluids. And the fourth point is that after touching the patient, that is, after you touch the patient, you have done all the procedures, and then coming out of the room, you are going to do the hand washing. As well, we will be doing like after touching the patient's surroundings. So, patient surroundings in the sense like might be his bedside blocker or his cardiac table, attendance cot, everything will be coming under patient surrounding. Even the cardiac monitors or ventilators, all these are patient surroundings. So, after touching the patient surrounding, even the patient doorknobs is also patient surrounding. So, until you come out of the room, till you reach the nurse's station, you will be doing the hand washing. So, these are the major 5 moments. So, you should not forget. So, I have already given a mnemonic such as Baba. Before touching the patient, after touching the patient, before touching the patient's surroundings, or after touching the patient's surroundings, before any clean or aseptic procedures. So now here I have given you the common flora. The other one is transient flora. Resident flora, in the sense you can see these microorganisms deep in the inner layer of the skin, whereas transient flora is seen in the superficial layer, that is externally you can see these microorganisms. The resident flora is the permanent flora. Always that microorganism will be present in any individual, might be of any age group, pediatric, adult, all the cadres will be having this particular sort of the same microorganisms. And then you can see the other difference in between the resident flora and the transient flora is that these are temporary flora. That is only due to might be getting into the hospital that microorganism is sticking onto the patient's skin. It is not a normal growth of organism. Only due to hospitalization and due to our improper hand washing, they could have grown that particular organism on the skin. Resident flora, if disturbed, re-establish themselves. That is, if you try to kill them, it will grow again. But whereas this transient flora, they do not re-establish themselves. That is, once you do the hand washing, it is not going to go to the other patient. It is still on that particular area itself, on that particular instant. Not removed by routine hand wash. That is, you are not going to remove just if you do the surface cleansing, you cannot remove the flora because it is deep in the layer I given the first point, right? Similarly, on the transient flora, as it is superficially present, you can easily remove just by doing a hand wash. And it is not associated with transmission of infection. Might be the resident flora, if it is increased, the patient only will have the disease. He is not going to produce. But in case of a transient flora, the infection will be transmitting from one person to another. It is difficult to remove a surgical scrub, but whereas this transient flora, which is the hospital acquired infections, can be easily removed by a simple hand rub itself, just a alcohol hand rub. Examples for resident flora will be diphtherioids, propionibacteriums, whereas in case of transient flora, you have all the antibiotic resistant. Methicillin resistant Streptococcus aureus, vancomycin resistant Streptococcus aureus, then vancomycin reactive agents, or you call it as events, vancomycin reactive events. So I told you normally in all the individuals they will be having the growth of the organism. So it can be starting from our skin. So I think myself or the person who is sitting in the last bench also will be having that growth. That is Staphylococcus epidermidis. But if you do a hand rub, you can prevent this infection from spreading from one person to another. Nose, inside the nasal cavity you have Staphylococcus aureus. So these are taken from the next source. The first one you can see, it is green in color. These two with two molecules attached to each other. So that is denoting the Staphylococcus epidermis. And the second one is like which is present in the nasal cavity. So they are forming like a clusters and they resemble in the color of a deep purple color under the microscope, which is your Staphylococcus aureus. Next, present in the mouth and throat, you have the Streptococcus viridans, which is forming like a chain-like fashion. So this is present in the mouth and throat. And the next you have dental plaque, which is mainly Streptococcus mutans. So it is mutants in the sense it is multiplying more and more and more very fast, which is resembling to the organism which is present in mouth and throat, but it is in large number. You can see the multiplication compared to this picture and the other thing. And this is Bacterocytes fragilis, which is present in the colon, and you can see very close to it, which is having so many of flagella, which is the E. coli, very commonly seen in the colon. And the remaining two will be group B Streptococcus, and which is you have the vagina lactobacillus, which is present in the vagina. So these two are normally present in all these areas. You can have a swab, put it under the microscope, it is normally present. But unless if your immunity is compromised, you will develop an infection. Any client can develop an infection. So the common agents what we use is that might be isopropyl alcohol, or you have the commonly used chlorhexidine hand wash. So coming to the steps of hand wash and hand hygiene. So one is in blue color, the other one is in orange color. So which is denoting your steps of hand wash and hand hygiene. So hand rub and hand wash all are coming under hand hygiene. But I told you, like in case of contact precaution, you have to create the foam, that is detergents must be applied. So detergents we cannot directly use on the skin because it is irritating. So in those cases we will be using the betadine solution, or you call it as the chlorhexidine scrub, to remove the microorganisms, to create the foam. So that only you are using these steps under the faucet, that is under the water, running water, you are taking the amount of solution which is needed, and then first you are doing palm to palm, that is you are going to take the solution, wet our hands, once our hands are wet, then take the solution and scrubbing them very deeply palm to palm. Then after that you will be doing left palm over the right dorsum and right palm over the left dorsum, which is vice versa repeat. Once the upper surface is cleansed properly, then we will go in for interlacing then interlocking. So interlacing, that is between the fingers you are going to do a scrub, and then interlacing like between the both the fingers, that is left and right, we will be doing vice versa. And finally the thumb rotation, both the hands, and then you do the fingertips, because even in the fingertips microorganisms will be present, fingertips, and finally the wrist. Then you can do the hand washing. So if it is a surgical hand wash, you will be doing up to the elbow, just above the elbow 2 inches. If it is a medical hand wash, you will be doing above the wrist 2 inches. Then the water source must be, if it is a surgical hand wash, you will be doing from elbow to the tips. And if it is a medical hand wash, it is from the tips to the wrist. The same technique will be applied when you are using the hand rub. So what will be, you can't see the textbooks, which is a point, which is practice. Order will be first initially given. Like you will be telling, my board is always 100% cleansed. I will do always 100% hand wash. But to test whether you are doing it rightly, we can use this chlorderm powder. This powder will be very minute in nature. You can take a very small amount, might be less than a gram, and you are going to do all these steps. Once you have done all these steps, we will pass the UV light. So that terms is actually UV light. So that UV light, when you pass over the hands, you can see wherever the glow powder is applied, glowing will be there. Your hands will be glowing. Whichever areas you have not used or you are not cleansed, that area will be appearing dark in color. Then you can easily caught. Oh, you didn't do the scrubbing onto the lateral side. You didn't do the scrubbing on the finger rotation or on the tips. Easily we can identify. So after that, what they do is that we will ask again to do the hand hygiene by soap and water. Now, first we are just checking whether you are using the hand rub very correctly. Instead of giving the hand rub, what we do? We give you the glow powder. Then after that, I will pass the dots and see where are the critical areas again retraining will be given. For example, if I have given the glow powder to you and if you have used, then if I pass the dots like this, the UV dots, if I feel that the palms of the right hand is not clear, then retraining will be given to the particular nozzle area. Then again we will be asking the same person to do hand hygiene by using soap and water. So now we will also identify whether they are applying the soap solution also equally. So after that again I pass the UV light. In this time there should not be any glow powder. You understood? If there is glow powder, which indicates what? You have not done the soap and water properly. So easily we will get caught. That way we can give the training in both hand rub as well as hand hygiene. As of now I am not having the glow powder as well as the UV light to test on you. But still in the hospitals we practice this by analyzing whether they have got the point. So now I will call upon our volunteers to do the hand wash. Yes. Yes. So I will be an assistant to provide the hand rub because it is not in the fashion of self-taking. So I will do the video. The first important point is that you have to remove the accessories. Like might be your rings, watches, bracelets, all that should be removed. Even if it is a marriage ring also, no problem. Your husband won't run away, our wife won't run away, they see that. But see that you are going to remove the ring. Because they have given evidence-based research that under the rings, n number of microorganisms are. Yes. Then after that, giving the hand rub. So now we are using actually chlorhexidine hand rub. Yes. Yes. Very good. Hand rub, the time sequence is less than up to 30 seconds. And for the soap and water, you can go up to 60 seconds. And if it is a surgical hand wash, it is up to 3 to 5 minutes. Who is the next volunteer? Yes, Radhika. So you can see that she is removing all the accessories before she does. And you also keep in mind, after doing the hand washing, don't immediately grab and go to the patient. All that should be put into your pockets. You don't have pockets. So you see that you keep the items safe. Just because you are going to give care, don't do it.
Hand wash steps, procedure steps. First one is apply enough soap solution. Rub palm to palms. Right palm over the left dorsum and the left palm over the right dorsum. Rotational rubbing of the thumb. Rotational rubbing of thumb in palms. Interlaced fingers of the both hands. The wrist rotational of the both hands. After doing hand washing, rinse with the water and dry out with the towel with our hands. Hand wash procedure வந்து அதோட பர்பஸ் என்ன அப்படின்னா அது வந்து இன்ஃபெக்ஷன் வந்து ஸ்ப்ரெட் ஆகுறது வந்து குறைக்கிறதுக்காக ஹேண்ட் வாஷ் வந்து பண்ணுவோம். பிஃபோர் எப்போ பண்ணணும் அப்படின்னா பிஃபோர் அண்ட் ஆஃப்டர் டச்சிங் த பேஷண்ட். ஏதாவது ப்ரொசீஜர் பண்ணுறோம் அப்படின்னா அதுக்கு முன்னாடியும் ஆஃப்டரும் வந்து நம்ம ஹேண்ட் வாஷ் பண்ணணும்.
Very good. Any other person? Yes. Accessories are not there. She is a dedicated nurse.